Good evening, everyone. I am Richa Sera, Editor-in-Chief, Responsible Hospitals. And today again, I welcome all of you to our Insta Live session. And today's session is more about the gallbladder, something which is related to stomach and issues related to that. So we're gonna discuss all that. I'm sure many of you must be facing a challenge of stones in the gallbladder and what is the role of gallbladder in our body. So that's something which is quite insightful, which everybody would want to know. And I think this is the time that you would have a lot of queries, and we'll be resolving each and every one in a moment. So I'll be adding Dr. Mayank Madan, who is quite well known and is a star doctor, quite popular in Delhi NCR, quite big. So I think it will be really a good session and everybody will enjoy that. So I'm going to add him soon and we'll start the session ASAP. I could just see him and I'll just try to add him in a moment. Guys, in case any of you have any questions related to that, because he's a big time surgeon and he's a pediatric surgeon. And hi, Dr. Mayank. Can you see me? Hi, good evening, Dr. Mayank. Can you see me? Hello, can you hear me? Hi, I can see you, but there is a network issue. I think it is getting hanged.
Okay, just give me a second.
Yeah, it's better now. I think it's better now.
Okay.
Yeah. So welcome, Dr. Mayank. I welcome to you on this session because we are doing it for the first time. Can you hear me now? I think there's a network issue. Guys, I'm going to try adding him again. There's a network issue a bit. Just a second. Yeah. So guys, I'm just waiting for him and we'll start the session ASAP. Hi, Dr.
Yeah,
Mayank.
sure.
Can you see me now? Can you hear me?
Yeah, I can see you. I can hear you also. Can you?
Yes, I can. Thanks to you.
Okay.
And first of all, I would like to welcome you to our session. And it's our honor, it's our pleasure to have you here. And it's an interesting topic which we're going to talk about today, Dr. Mayank, that regarding the gallbladder, which is something a part of the body, but hardly somebody talks about it. Though people have a number of issues related to that part. So we'll be talking about it. And if you can just talk, what do you think, what gallbladder, how important the gallbladder is for a body? If we can just start with it.
Okay. So gallbladder is in the common language, if you can know, it's called pit ki theli. You must have heard about this word, pit ki
That's true,
theli.
yeah.
So it's that organ. It's a balloon kind of organ just beneath your liver. And there is a misconception about the function of it. People say that it is producing bile or pith, but it's not like that. It's actually a storage organ for the bile. Okay. So if I can show you a little pic, I'm just turning my camera
Sure.
towards my laptop, so that will give you a better idea about this. Can you hear? Can you see this?
Yes, I can.
So here on the right side of your body, just under the rib cage, you have this liver here. Okay.
Okay.
Yeah, I'm pointing it. This is the liver on
Yes,
the right
yes.
side under your rib cage, and just beneath this, this is a small organ. This pear-shaped organ. It's called gallbladder or pit ki theli. Okay.
Okay.
Yeah. So
Dr. Mayank, can you
what-
just lift your camera a little down on the picture side? Yeah, now it is visible. Yes.
okay. So here is the liver, and here, if you can see, this is the gallbladder just underneath the liver. Okay.
Right.
So the liver is producing the bile or the pith,
Okay.
fine,
Okay.
and it is getting stored in the gallbladder.
All right.
So the primary function of gallbladder is the storage of bile.
Okay.
So let me put it in other words, or let me put it even more plainly and clearly.
Absolutely.
See, your liver has got no switch. It has got no switch for producing or stop producing the bile. Okay.
Mm-hmm.
So liver is producing it all the 24 hours, but you're not eating it all 24 hours.
Right.
So you get it. So the excess bile which is there, that gets stored into the gallbladder, and this bile is required for digestion of fats.
All right. Okay.
Yeah.
So,
So
yeah, please carry on.
no. So if there is even a smallest amount of fat in your diet, that needs some amount of bile to get digested and absorbed. So that's where the function of gallbladder comes. So this is the primary function. That is means the excess bile that gets stored into the gallbladder. Fine.
Sure. So, since you've just mentioned that the extra things get stored, I mean, how is it impactful to our body? Is it good, bad? How, because we hardly get to see that. People talk about that, liver खराब हो गया है. Liver का सबको पता है कि ज़्यादा drink करने से liver खराब होता है. But gallbladder ka, I think people talk about when there is a stone or there is a stone
Yes.
issue. Then only this
Yes.
thing comes in a mind ki,
Yes.
there is a stone in the gallbladder. Otherwise, we hardly get to talk about it.
Yeah.
So, also, what do you think? How is it impactful? How can we be more watchful about it? What all needs to be taken care if that has to
Okay.
be saved or that has to be kept
Before,
nicely?
before I come to that point, I would like to tell you one more thing about the gallbladder.
Yeah.
Okay. So once the gallbladder has stored the bile, the secondary function comes into play when you eat something. Okay. So at that point of time, the gallbladder, can you see it now?
Yes.
So at that point of time, when you eat something, the gallbladder gets the signal. It gets the signal that something has gotten into the intestine here. Fine.
Okay.
And at that point of time, gallbladder pumps it. Can you see the pumping action?
Yes, I can.
Yeah. So this is the secondary function of gallbladder. That means it helps in mixing the bile with your food into the intestine.
All right. Okay.
So for the from the point of view of understanding why the stones form or what do the gallstones mean, this function is very important. So primary function is storage, which is passive. The secondary function is the pumping action of the gallbladder, which is an active action of the gallbladder. Okay.
Sure.
So now the one more fact that needs to be understood is that all the cholesterol that you eat or the cholesterol which is getting converted from other form of fat, that is being circulated in this bile.
Okay.
So if the gallbladder stops functioning or if its function is not proper, say, usually we expect that 70 to 80% of gallbladder should empty itself. Whenever we eat something, at least 70-80% of the stored bile should get into the intestines. If the gallbladder is not pumping properly, what will happen now? The bile will stay in the gallbladder itself. And there is cholesterol in the bile. So the cholesterol starts sedimenting inside. So this is this sedimentation of cholesterol, this is the cause of stones in this case. And as I mentioned, this starts happening when the gallbladder has stopped doing its proper function.
Okay. All right.
So,
Such an important thing because we hardly get to see and people are writing it on the chat, we never realize the importance of this ever. So that's thanks to you. Doctor, since you've just clearly mentioned that what are the functions of gallbladder, maybe we can just talk about that. What is, as we all know in a layman term, that we have a stone in gallbladder. So why stone is always majorly found in the gallbladder, and how does it develops? Maybe if you can just talk about it.
Yeah, as I told you, these stones majorly they are cholesterol stones. 95% of these stones are cholesterol.
Okay.
Rest of the stones they can be mixed stones. In certain people, like you must have heard, people who have got thalassemia or some blood disorders like sickle cell anemia, or in which there is breakdown of red blood cells. Those people can also have some sort of stones, in which case they are called pigment stones. So these are primarily two kind of stones.
Okay. You there? Guys, there's a little issue. I'll just wait for him for the network. Yeah, I can hear you now. Now, yes.
Okay. I think my video is paused.
Yes.
So what I was telling you that 95% of these stones, they are primarily cholesterol. The rest of the stones, they are actually cholesterol. Rest of the stones are only pigment stones.
Okay.
Okay. So, and the main reason for the formation of cholesterol stones is that the function of gallbladder is not proper. We don't exactly know why it happens. What are the reasons behind it? Um, uh, it might be in our genes only. It might be in our race, as I can, as has been known in various literatures, that we in the North Indian belt, we are the word capital for all gallbladder diseases, including gallbladder stones, gallbladder complications, gallbladder cancers. Also, we are word capital for that. So there has to be something with our genes. We really don't know how to process cholesterol. We really have a kind of cholesterol which gets deposited everywhere. So that's the primary reason. And yes, I think what you wanted to ask me was if there is something how we can prevent it. I think.
Basically, I think we will talk about the prevention. I just wanted to know maybe how does it affects our body. Uh, a lot of people would they would want to know that if there are stones also in the gallbladder, is it like, I mean, a number of things are there, so I'll go one by one. So how does it affect our gallbladder basically? Is it serious? Is it okay to have stone just like that?
Can you actually see me, Richa?
No, your video is still. Maybe you
Right.
have to resend the request. I cannot interact.
Resend the request. Okay. Let me try it
Yeah,
again.
yeah, please. Guys, I think I'll be adding him soon in a moment. So you just stay with us in case anybody has any specific question about the stones, gallbladder, stomach. I think this is the right platform. Please keep writing your questions, and I will pick up your questions in case I feel that this is something which is important and something which is relevant to our topic, which we are talking right now.
So once the stones are there, I think there are a number of misconceptions about it. People take it very lightly, very lightly. People think that it is almost like you got stones in the kidneys which keep on forming, getting out of the gallbladder. It's not like that. I think that's the only point I want to highlight in this Insta Live today, that it's not at all like kidney stones. They are totally different. They have got totally different pathology, totally different etiology, and totally different spectrum of complications and symptoms. Okay. Usually, what comes to our mind? We feel that okay, I don't have any pain. Most of the people come to me and they say, oh, I got ultrasound done and there is no pain. So why should I get it removed, or what? Why should I even be bothered about it? So it's not like that. We really uh, we really don't want you to get into pain to appreciate that this is a problem. Because there's very subtle symptoms of gallbladder disease. As I told you, it is required for digestion, especially digestion and absorption of fats. So the primary thing that happens when you got gallstones is bloating sensation. This is the first symptom. People feel कि मेरे को gas बनती है, मेरे को acidity होती है. This is the first thing people get confused. And we keep on taking over-the-counter drugs. Somebody's taking Rantac, somebody's taking Pentop, somebody's says कि मैं तो 6 महीने से Pentop ही खाई जा रही हूँ, या मैं खाना खाती हूँ तो उसके बाद मेरे को 15 मिनट चलना पड़ता है, तब तक मेरे को I feel bloated, I feel full. So that's the primary symptom. That is where you should think that you should be
What is
consulting.
that system? If you can just tell it again, the second one.
I said it's bloating. It's a bloating.
Bloating. Yeah.
Bloating or fullness. Some people say that that there's a lot of flatulence. Other people say they burp a lot.
Okay. Yes.
That's simply because the food which was supposed to be mixed with bile and then digested is not getting digested properly. What happens if you leave food somewhere? Okay, on your kitchen shelf, if you leave food, what will happen? You start fermenting.
Absolutely.
So it's a similar kind of thing that happens here. That causes bloating, that causes burping, that causes a lot of flatulence and fullness. So these are the first symptoms. And the pain usually happens in later stages of the gallbladder disease. Okay? And it usually happens, we'll again come and show you this because that's how we can understand it properly.
Okay.
Can you see it now?
Yes.
So the stones which are here, if at any point of time it gets slipped and comes to this point, okay? This.
Okay.
This is called the neck of the gallbladder. These are very small ducts. These are say hardly 2, 3, 4 millimeter size ducts, which are there, which are transferring the bile. Okay. So in case the stone gets stuck in this cystic duct or its opening, it is then the people start getting pain. Fine.
Okay. All right.
And the pain is typically in the center. It's typically just below your chest, starts in the center in upper abdomen, goes to the right side or maybe to your back, and then finally to the right shoulder. And the pain is actually severe. Pain is actually severe, and it may be associated with nausea or maybe vomiting along with this.
Okay.
So, as I wanted to tell you that we should not be actually waiting for this kind of pain to happen. So primarily, whenever you start feeling that there is some bloating sensation, there is some fullness, there is this. So at that point of time, it's then and there that you should be consulting a doctor. It's not like appendix.
Absolutely.
If you're having these kind of symptoms, definitely you should consult your doctor because all the complications associated with the gallstones, they are actually life-threatening complications, which will come eventually. I'll come to all those things.
Sure.
So symptoms that you were asking me, bloating, then fullness, maybe flatulence, burping, then the pain, which may be associated with some nausea and vomiting. Okay.
So you have made it very clear because I think you are right. A number of people have a mindset thinking that it is gas, and they usually take Rantacs, Pantops. I think my brother also. Now I can actually connect because he has stone issues as well. So I mean that's something which you have picked up in a very right manner because nobody realizes that it could be related to that as well. So they think gas is something which is normal, which is with almost everybody, and theek hai nahi goli khana hai, that's all and it's done. So when somebody realizes such kind of effects, the moment you said that they find such symptoms, so what is the next step they should go? They should be required to see a gastro or a gallbladder specialist. Who should they go and consult? That should be the first step, or a physician.
I think anyone means first of all, first is to get to realize that there is some problem associated with it. It's not simply gas. It's not.
I lost you. Yeah.
So anyone, means maybe you can come to a physician, you can come to a surgeon, or maybe to gastroenterologist. I think all would be directing you to a proper place eventually.
Yeah, you're right eventually, but doctor, sometimes you realize that when you go to a physician or you try telling them in a way that they also find it कि ये तो gas का issue है. So you never
Mhm.
get to find a right problem.
Yeah.
I think my mother is an example for it, and she's been going
Mm.
to a number of doctors. She always said that it's gas and it is normal. So
Okay.
they never get to see a right doctor, and you actually push some people who are aware and they understand, and then they push.
Mm.
No, you have to consult a gastro. It's a
Yeah.
time and
I
it's a
think
need.
I think a gastroenterologist or a surgeon, he is the best person to get in contact with. And it's a very simple investigation that can help us diagnose this issue. Simply an ultrasound. You go and get an ultrasound done, empty stomach, hardly 5-10 minutes job. You get to know what is happening inside. So eventually a surgeon or maybe a gastroenterologist, but eventually finally you will have to come to a surgeon only, because that's where the treatment will be. Okay.
Sure. So, doctor, now you have to tell me that is it really dangerous to have stones in gallbladder?
Yeah, uh, definitely, definitely. Because as I said, all the complications, they are actually potentially life-threatening complications. One of the complications, as I told you, if the stone gets stuck, if it gets stuck there in the cystic duct, at that point of time, you may have pain. In that case, there may be swelling in the gallbladder. It can start getting infected. There can be pus formation inside the gallbladder. And there is chance that one may land into a kind of sepsis, or the gallbladder may eventually get burst also. See, it's a very thin organ, thin walled organ. Hardly its thickness is 1.5 to 2 millimeter. Just 2 millimeter is the maximum thickness of a normal gallbladder. So if a stone gets stuck there, there is nothing which can get inside or get outside. So eventually, if it doesn't get dislodged, there are chances that it can get burst inside your abdominal cavity itself. In which case, it's a life-threatening condition. One may have to go in for a complete laparotomy. Complete means opening up of abdomen in that case. The second complication which can happen, as I show you again, can you see you? Can you see this?
Not clearly. Maybe you have to just shift down your camera. Yeah.
Okay.
Yes, I
Now,
can. Yes, better.
so if any of the stones it gets if it passes through this part, if it gets into this thing, so this is the most important structure in this whole biliary system. This is called the bile duct. Okay.
Okay.
So this bile duct is transferring all the bile from the liver through the gallbladder into the intestine here. Okay.
Okay.
So if any of the stone it gets passed into this bile duct, in that case you can see the bile will not get into the intestine at all. So what will happen? The bile will get into the liver here and gets refluxed back into your blood, which causes jaundice. So this is again a very serious condition. It's not like other viral hepatitis or routine jaundice that we get. It's called obstructive jaundice because there is obstruction in this bile duct system, which can eventually again lead to sepsis, or it can lead to infection, raise TLC count, high grade fever, sepsis. All those things can happen in this. Okay. And maybe shock also. The third complication which can happen here, if you can see this organ, can you see this? This is called pancreas.
I think I can't.
Now,
Yes, I can see now. Yes.
okay. So there is this organ, this is called pancreas. So this is another organ which is secreting all the other digestive juices here.
Right.
Okay, so this is the pancreas here. So the digestive enzymes, they are being produced in this pancreas here. And this bile duct passes through it. So if there's any stone which passes from this part, it can cause infection in the pancreas eventually.
Okay.
And this condition is called pancreatitis.
Okay.
Pancreatitis again is a life-threatening condition. Around 30% of the patients, they in first presentation land up in ICU if they get this. So it is that serious a condition. So again, I want to tell all my viewers, all people out there, that this is actually a very serious kind of condition. If you get gallstones, this is not like kidney stones. In kidney stones, we know that you might pass stones. If you may be passing smaller stones through the ducts or through the ureter or through your urinary system. Here in this system, we really don't want anything to pass out of the gallbladder itself. Once it is out of the lumen, it is bound to cause complications starting from obstruction, then maybe some bursting of the gallbladder inside, maybe jaundice, then maybe pancreatitis. All these things are potentially life-threatening.
Obviously, yeah.
Yeah.
Very critical, yes. So, doctor, I think that's quite insightful, though. So, I am quite curious, asking the another question, just going in the flow. So, let's say if somebody has not consulted a gastro and he was not having such similar symptoms the way you mentioned, and suddenly he got pain, and he realized that there is a stone pain or on a certain area, because people connect that it could be a stone pain. What do they have to do? What step they have to take then and there? Because I'm sure and I've heard that pain is like, I mean, it's quite high, it's quite too much.
Quite severe. The pain is quite severe. In that case, I would suggest that you should definitely consult your surgeon itself directly.
Okay.
Yeah, you should consult the surgeon, because eventually the treatment comes down to a surgical procedure.
So there is no other way which is without, because somebody has asked this on the chat box also, that is there any way to get this stone out without surgery?
Not at all. As I told you, we don't really want this stone to get slipped in any eventuality. If it gets slipped out of the gallbladder, it is bound to cause complications. First thing, there is no way out that the stone can pass out at. First thing. Second thing, as I told you in the beginning itself, these are not like kidney stones. Kidney stones are actually mineral stones.
Okay.
In kidneys, what you get stones, they form from calcium, maybe phosphorus, oxalates, uric acid. Those all are minerals. They can be washed off, but not these stones. These are formed of cholesterol. 95% is cholesterol. You really can't have, can you see fat getting dissolved in water and getting washed off? Never.
So if someone, sorry to cut you, but if someone, is committing you in Ayurveda that, have these churans and all, and look at the magic which will happen. I'm sure most of people
yes,
coming to you saying that कि मैंने तो आयुर्वेदिक भी किया है, मैंने ये भी किया है, मैंने वो भी किया है. So
this is very commonly a statement I listen in my OPD. Even today itself, there was one patient. So she had a 12 mm stone and she was into some Ayurveda and all. Somebody told, I'll get it definitely out. And today she came in pain. The stone was now 17.7 mm. So what I usually answer in these cases, if you give me even one single example where the stone has got dissolved after formation, I'll stop operating gallbladders.
Oh, wow.
And I am telling
that's
this
like
on this
big
platform.
Statement. I mean, guys and viewers who are listening to this, and I think it's really making sense, because I think you have clearly mentioned if it is in gallbladder, I think it has to be removed through a surgical procedure.
It has to be
or
removed.
Else there are ways of doing it. If it is in kidney, it can come out.
Yes, definitely. We also give some medications. We also give some medication which can alter the pH of the urine so that the stones get dissolved, but not for gallbladder at all. For God's sake, I really request all these. Richa,
I can't hear you now. Doctor, I have lost the network, I think. Guys, I'm trying to add him again. Yeah, I can see you and hear you now. Yes.
Actually, I was going to make a statement again here. I was going to make a request to actually all the respected people and doctors from other pathies homeopathy, Ayurveda, Unani, and others, please, please don't claim that you can treat this with any of your medications. Please, there is not even a single case which you will, which you can show me that the stone has gone with any of your treatments. Please send these people to the right doctor immediately whenever you find. Of course, I have high requests for all these people, but there are certain things which are actually being can be managed by allopathy, which can actually be managed only by surgical procedure only. So I request all of you, I request all of these doctors also to please guide your patients and send them to the right person. Don't claim that you can do anything about it, because waiting uh, on these stones can eventually lead to some kind of complication only, which can be life threatening for your patient only. Okay.
Absolutely. I absolutely second you in this because you're right. Because just with a simple misguiding way, you actually, you're not doing the right thing. I think it's very important to let them know clearly. That's the only way out. Like the way you
Yeah.
are telling us, because I myself wasn't aware. Maybe I was having a myth in my mind that surgery ko everybody would want to avoid.
Yes.
Everybody would want to avoid surgeries. So any second person who would be talking ki there are the ways which can be done without the surgery, people would want to try them first, and then at the end they will pick up the surgery procedure, and
Yes.
by the time I'm sure the problem will be like miserable, more miserable. So I think they
Actually.
should take the right way, straight away.
Yeah.
So I agree, absolutely agree with you, doctor. So I'm going to pick up one question right here.
Yeah.
Somebody has
Yeah.
asked, the ultrasound should be once a year. Elaborate the time period as free symptoms as bloating and all keep popping up in many of us. So that's the question.
So it means that there are no stones so far in the ultrasound. Should I take it that way? That you have bloating but no stones detected on the ultrasound. That's why you're going to repeat it.
Yeah, because
If
I think
that,
she's saying that I don't see any major symptoms, but I get bloating. So should I get my ultrasound done in a
yes.
year
In
once?
this
Is
case,
that enough?
if yeah, if the ultrasound is showing any stones, then definitely you should consult your doctor immediately. Fine, there is no point waiting that you will be doing an ultrasound after a year or so. It's not like that. If there are no stones detected and still you are facing the problem of bloating or these upper abdominal symptoms, again I would suggest that do talk to your doctor, because bloating is not just because of one gallbladder stones. There can be other reasons also, and what we call as acidity or bloating, they can have some other reason. So if you are facing any symptom, I'll say to consult a doctor. Not just wait on it that I'll do an ultrasound after a year. You can't be, you really can't be a doctor to yourself. Fine. And once you find that there are stones, then there is no point waiting. Then you have to contact your surgeon itself.
True.
Okay.
True. So, doctor, since we've just spoken about the effects and how dangerous it could be, you have also mentioned that what steps they have to take in case they find what are the symptoms of it. Now we can just
Mm.
talk about how to go about it. So, in case somebody find the symptoms, and so how do we prevent it? What are the ways of preventing this? And is there any way of preventing it totally just with a surgical way? And how do we go about it?
See, actually speaking, there is no definite uh, reason for the formation of these stones, which is preventable reason, I'll say. Okay. There is nothing that you can actually do, or maybe by curtailing the fat or something. It's not like that. It's eventually in your genes, it's eventually in our race, it's eventually how your gallbladder actually functions. Of course, there are certain things which can help you. That is, if you can, if you're maintaining a healthy lifestyle, if you're not too much into fats, and if you are doing routine exercises, if you're not too much into alcohol, so these things can help you in certain ways, but there is no proven thing that if you do all this, there will be no gallstones.
Mhm.
If
So
they have to happen, they have to
absolutely, I
happen.
was also about to ask this, that because people have been asking, is it related to the diet or is it related to the lifestyle? So I think that also could be one of those aspects, but
Yeah,
not necessarily. You said.
not necessarily. Not necessarily. Actually, as I told you that we North India, we are the world capital for all these gallbladder diseases. So it's actually in our race. We don't know how to process the cholesterol. Our blood cholesterol may be normal. Even if our blood cholesterol is normal, the concentration of cholesterol in the bile that may be very high. So that may cause stones.
Sure. So, doctor, you just mentioned. So, since you have just clearly mentioned, the surgical way is the only way to
Yeah,
clear up the gallbladder part, the stones. So,
yeah.
is that very successful? And afterwards, do you think the person will be totally fine, or they require something else? What are the ways afterwards, after the surgery?
First of all, I would like to give you a few things, few facts about the surgery itself.
Sure.
Surgery is a scary word, I'll say, but not in the today's world when we have such advanced medical facilities. The
Yeah.
surgery is conducted by doing only laparoscopy. It's called a keyhole surgery. We make small holes in your tummy. The maximum size of the hole would be, say, around 1 centimeter. That is only 10 millimeter hole. That's the maximum size. The rest of the holes are only 5 millimeter holes through which the whole surgery is conducted. So hardly 20, 30 minute surgery, I'll say max time. Just 1 day in the hospital. And see, everything has to be seen from the point of view of having the pros and cons. If you're
True.
having a surgery and you're avoiding some life-threatening complications, it is worth it. And if doing it, you are exposed to minimum kind of risk, then again it is worthwhile. Probably it would not have been so popular, this surgery, maybe around 20, 30 years back, till when we used to do open surgeries. Once the
Right.
surgery was done, people used to be in bed for 3 weeks, 4 weeks. They were not allowed to do any exercise after this. Now the surgical procedure is so refined by laparoscopy, by the minimal access surgery or the keyhole surgery, that 1 day you get surgery done, next day you are back home, fourth or fifth day you are back on your desk job. What else do you want?
Wow. That's amazing. That's beautiful.
And with us means nothing to brag about it, but there are no tubes put into any body organs after this in your tummy or nose or catheter, nowhere. Just after 3 or 4 hours of surgery, you're out of bed. By evening, you're started on liquid diet or maybe a soft diet. Also, next day you take normal diet and you're back home. So that's how simple the process has become. So,
Absolutely.
and yes, I think very important question that people ask me after this is if there is any change in my lifestyle or any change in my dietary habits after this. Lifestyle, we encourage you to have healthy lifestyle. We encourage you to do walk from the next day itself.
I've lost the network again. Guys, looks like very important session. I am sure people who are listening to it carefully would be really benefited about it, and they would be more aware, because these are the things you hardly get to see. You hardly get to know about all these things, and everyone should know, because you may have such ideas maybe anywhere. You might need such help anywhere. So I was just telling the audience that such insights you hardly get to see.
Yeah.
So you would not know. Even I keep on talking to doctors, but since I never faced this challenge ever myself, I have no idea that what is the process, how safe it is, and surgical looks like big surgery. So the way you
Yeah.
have been saying, it looks like okay, a normal thing, because when you do delivery of babies, I think those surgeries are more broader and
Actually,
bigger.
it,
Yeah.
it is said that having a normal delivery or having labor pains, that is construed, uh, and there is evidence that it is the maximum amount of pain that one can have in a labor.
Absolutely.
And if you're not going through normal labor, and if you're going through CS, cesarean section, that is, say, around 10, 12 centimeter of cut is there in your body to take the baby out. So compared to that, the laparoscopic surgeries or keyhole surgeries, they are just, I'll say, minor
It's
ones.
nothing. Yeah.
Yeah.
I know, I can imagine. I've experienced it. So I faced all that. Yeah. So cool.
So
I think
regarding the,
good you have told. I think we have covered almost everything related to the effect. What are the procedures? What are the measures and steps to be taken? And how can we prevent it? You just mentioned that the surgical way is the one, and this is a very simple surgery which can bring. So anything after, so afterward the surgery,
yes,
after the surgery is
there
done,
has to be,
so
see,
any medication they have to follow for a long time, or is it the one-time
nothing at
procedure
all,
which is done,
nothing at
or
all.
do they develop
You,
stones again?
okay. So I'll come one by one. So the medication after this is
Yeah,
usually, say, around 3 or 4 days, 3, 4 days of antibiotic that we
that's
usually
all.
give. That's a very simple antibiotic. Painkiller is usually given for 2 to 3 days only. That's a simple combiflam that works.
Awesome.
Simple combiflam, very simple antibiotic, and an antacid. That's all that is given for next 4 or 5 days. That's it. The sutures, we usually put absorbable sutures there. You do not even need to come to us. Usually we call after a week's time so that we can see the biopsy report also, and once to see how it's healing well. Third point, you asked me about any long-term medication. No, not at all. Not at all. Fourth thing I would like to comment upon is the dietary change after this. See, uh, uh, with the gallbladder gone, the storage function of bile is also gone. The gallbladder used to store the excess bile. Now the storage function is gone. So if in the post-op period or in early post-op period, you take lots of fats, you may again feel that feeling of bloating. So for first 6 to 8 weeks, we recommend that you should take low-fat diet, just low-fat diet. I'm not saying fat-free diet or boiled diet, not at all. You should take only low-fat diet. ऊपर से घी मक्खन मत डालो, ठीक है? नॉन स्टिक में खाना बनाओ, नॉन स्टिक का खाना अगले दिन से खाओ, ठीक है? Don't put any additional ghee, makhan, maybe pasta, burger. This you have to avoid for 6 to 8 weeks. You should avoid, during which time your body actually adjusts to the new system. And the fifth point was, you asked me if the stones form again. No, the gallbladder is gone. There is no gallbladder now, so it cannot form the stones again.
Okay. Okay. Somebody is asking me, people say after removing gallbladder, your digestion is permanently disturbed.
Not at all. Not at all. As I told you, it's only in the initial phase when people may have some issues taking fatty diet. They may experience bloating and burping at that point of time, but not as such with digestion permanently, because the bile, as I told you, is being produced by liver. We are not touching the liver. The bile is still being produced by the liver, which is required for the digestion of fats. So there is no problem in digestion on a long-term basis. Usually for the first 6 to 8 weeks, maybe some people that too, they can have some issues having excess fat. That's it.
Okay. Cool. So, doctor, I think I am done with almost all the questions. Just last question from my end is there any way to avoid the formation of the stones in gallbladder?
Not much that you can really do. But yes, if you can keep your weight in check, keep your weight in check. If you're maintaining a healthy lifestyle, doing exercise daily, then there can be uh, a better processing of cholesterol in the body. But again, there are no scientific proofs to say that this works and this doesn't work. But definitely, managing a healthy lifestyle, managing a good exercise regime, managing your keeping your weight in check, those things may help.
Perfect. I think that is such an insightful session, and I'm so glad that you are on our panel and we have been just talking about all this. And I never picked up this topic ever initially. So I think this is really important that everybody should know. And being a laparoscopic surgeon, and you're quite well known, I think a lot of people are like your view. I could see a lot of viewers are there, and they are sending you hi, hello, sir, hello, and they're quite happy to see you. So glad to see all that. So anything else at the end you would want to add on to give a message
Yeah,
to
one
your
thing I would,
viewers?
yeah,
Yeah,
definitely. One more thing I think that thing should be covered here.
yeah.
That is, see, we see these stones usually in females, maybe in 30s, 40s, 50s. This is the usual age group. But in certain people, we find stones in very early childhood, young people. Okay? So those are the people, those are the patients who should be extra careful now, even if they don't have any symptoms. See, children are very they don't come up with problems very easily, but so they won't be telling you कि मम्मी मेरे को बहुत ज़्यादा पेट में दर्द हो रहा है या मेरे को bloating हो रहा है, ऐसा नहीं बता पाते. They are very resistant to all these things. So if you find that somebody who is relatively young and has got stones, then definitely you should be even more careful and even more watchful and go to the doctor immediately, because uh, there can be other ailments which have helped in developing these stones. As I told you initially, there can be some hemolytic disorders like thalassemia or sickle cell anemia or other hemolytic disorders. They can be there. So those also need to be worked up in those cases. So in those cases, immediately you should talk to your surgeon as well as your pediatrician also, so that we can find out what has led to the formation of stones in younger
True,
age.
true, true. Very important because we sometimes avoid and ignore that.
Yeah.
इसको तो कैसे हो सकता है, ये तो बच्चा ही
हाँ,
है,
इसको तो कैसे हो सकता है, तो बच्चा ही है, अच्छा बच्चा है तो भी दर्द नहीं हो रहा है. So in
कुछ
that
खा
case,
लिया
one
होगा
thing,
ऐसे, all
हाँ,
that myths. I
excuse
think
me.
you're right. That's very important. Very important. Yeah. So, fair enough, doctor. I think that's a great advice for all of us, including the kids. At the right time, when you get to know about a right thing, I think it's really quite important that you get a right treatment and you can actually save someone's life. You there? Doctor, you there? Yeah. So I was just saying that thanks to you because it was really important when you get a right advice from a right person and you get a right treatment, you actually get to save someone's life. So thank you so much. This was really important, and I think I'll be meeting you again on another topic because we have so much to talk about. So thank you so much, Dr. Mayank,
Thanks,
and
thanks to you, Richa.
it's
Thanks
my
to
honor
you.
to have you here. Thank you so
Thanks,
much.
thank you.